Hi, I'm Ed Ullmann from Wellness RX. Today, we begin the first installment of a series of talks on the American healthcare system. First, we will address where we are today during an epidemic. Then we are going to look at the history of our healthcare system to better understand how we got to where we are today. And then finally, we're going to discuss ideas for moving forward. Our reflections will be a blend of hard facts and observations that I have made in the healthcare arena for close to 50 years. I've been in many roles as a pharmacist, as an HMO founder, CEO, county mental health director, county legislator, and explorer of natural medicine. So let's begin on where we are today in the middle of a once-in-a-lifetime pandemic. Without question, the veil has been lifted on our national health care system that absorbs 18% of our gross domestic product. That's our wealth. That's 18%. To put that into a context, Canada spends 10% of their GDP, and most other countries are lower than that. Looking at it a different angle, America spends $11,000 a year per citizen on healthcare, while other wealthy industrialized countries spend about $5,500, or half of what America does. One other perspective is that we spend 5% of our wealth or GDP on education. We spend 4% on national defense. So if you combine those two, of education and national defense, it's 9%. So between those two, we spend half of what we spend for healthcare. It's a big number. The war on COVID has also exposed a lot of things, but what I was most moved by was the deep gap that we now see on access to care that is according to race and income, and the complete separation of traditional health care and our public health care. These things have been most revealing for me. You know, looking back, who knew how unprepared we were for a pandemic? How dependent we were on international supply chains? Or how difficult it would be getting shots into arms. To achieve that success, getting shots into arms, we had to use mass vaccination centers that often required patients to drive 80 miles or more one way to get their first shot. Then they had to go back and do it again for the second shot. We had to recruit millions of volunteers of all backgrounds to the cause. And I am especially very happy that I was able to see American pharmacists step up to provide 30% of all COVID vaccinations. And then who knew how antiquated our public health systems were in reporting accurate vaccination statistics from around the country to the public. We need to do better. The fallout from COVID has been harsh, and we are still in the middle of the pandemic. American healthcare workers are just exhausted. They're burnt out. And some are just really angry at the unvaccinated that now are accounting for 90% of COVID hospitalizations and deaths. The end result is going to be that we have now seen the largest number of early retirements of healthcare workers in our history. This is significant. We are losing some of the best minds, the senior minds that can serve as our trainers. These are the individuals who have history. We cannot afford to be losing them, and we are losing them under the strain of COVID. As people demand now continues to go up for healthcare services, and just remember, we've been in hibernation, coming out of it now, but we've been in hibernation for quite some time. People just didn't go to the doctor. But now that they're coming back and trying to catch up, making appointments, it's pushing the healthcare system down to its knees, especially in the primary care side. It's trying to keep up, but appointments are being backed up. Most practices now, they're not able to accept new patients. And then if you keep pushing down, service has got to follow, it'll be compromised. And due to the time that it takes to become a licensed healthcare professional in America, reinforcements are just not going to be easy to be found for many of our healthcare workers, especially our nurses and our doctors. You know, another thing that I've observed during this period of COVID is that many Americans, many of my friends, have been able to do quite well financially during this time because the stock market has gone up, real estate prices have gone up. Many have been able to work from home and have had no loss of income and actually have been spending less money. And I say, okay, great, but not most Americans were able to be so lucky. And there's been great sacrifice and struggle that they've had to do. Now, where do we look at how this impacts us? Well, I looked at something that's very important, and that's the number of medically uninsured, are those who have no health insurance, and how have they done? You know, we worked really hard to bring down the medically uninsured rate from 15% down to 8.5% during the first 2 or 3 years after the ACA legislation or Obamacare was passed. Now, through COVID, we are now seeing it swell up to 14%. That's a big jump, and there's no cap to it. It can get uglier. And what does this mean? You have no health insurance for yourself and your family? You avoid health care. And then if you have to go, you go to the hospital emergency room. All right, the emergency room has to accept any American who shows up. So therefore, the hospital is then being hit with the bad debt that occurs. And then if they bill the individual can't pay it. The number one reason for personal bankruptcies in this country is because of healthcare costs. And it's a lose-lose situation. So these are the things that we have to understand is the fallout of COVID. Now, healthcare revenues and profits during COVID have not been equal either. I think this is very interesting, and most people don't drill down to look at it this way. But you know, if you were operating an HMO or a health insurance company, COVID has been great. You receive monthly premiums, and nobody's going to the doctors. Nobody's entering into the healthcare system. Therefore, you have no claims to pay, and you have record profits. But on the other hand, if you're operating a hospital or integrated health systems that have medical practices that they acquired, this has not been a very good time for you. And in particular, your revenues are down because you have had to delay or cancel all the voluntary surgeries, which are profitable for the health system. So we have a tale of two cities here when we look at the healthcare system right now during COVID. Stepping back, I'd like to take a moment and just to realize that, there have been some positive aspects of the epidemic. And so many of our healthcare workers, first responders, public safety enforcers, our skilled laborers, and millions of volunteers, they have stepped up during this crisis, and they have shown America at its best. And let's just give them an applause because they have made a difference. And although the immunization process started out quite rocky, as we all know, overall, eventually it worked itself out. And that is due to the great passion that was exhibited by our healthcare professionals, their administrative staffs, and all those millions of volunteers. Let's just say that is America at its great. In the end, we must do better than this. We got to do better than this. We can do better than this. And there's just so much at stake, especially for tomorrow's kids. Our next segment, we're going to start to look at what are the challenges that face us right now as we deal and cope with the American healthcare system. Thank you for listening. See you in the next installment.